Matibabu nchini umeelezea hofu yao kuwa wahudumu wa afya nchini hawajapewa mafunzo na vifaa vya kutosha kukabiliana na virusi vya korona nchini. Wanasema hili linaweka kwenye hatari kubwa ya kuambukizwa virusi hivi pamoja na familia zao. Walielezea kwenye kikao na wanahabari muda mfupi uliopita hapa jijini Nairobi.
All consultation rooms provide accommodation facilities for health workers working in isolation facilities for the period of outbreak to avoid spread to their families in case they are infected. Advice that we wish to advise the public as such, that the public appreciate that they have the greatest role in slowing spread of this virus by observing cough etiquette, avoiding crowding, ensuring washing of hands, and using sanitizers as well, visiting a health facility once they feel any symptoms. Adhere to the directives and advice given by the Minister of Health with the seriousness they deserve. Avoid purchase and use of face mask without advice from the health workers, as this will exhaust the available stock, making them unavailable to health workers who need them most. Must realize that stockpiling sanitizers and masks at home while denying their neighbors supplies of the same defeat the same purpose as prevention is more of communal as much as it is personal. We must not only take measure at a personal level, but also take them communally and ensure those around us are complying. We have further instructed our branch official and members to work with the Ministry of Health and the county government, County Department of Health as follows: that they help to fast track training of the health workers under different counties, ensure there are standards operating procedure on processing of suspected cases available to all, ensure there are enough personal protective equipment, ensure there are enough sanitizers and face masks for use by health workers in all facilities and all time. Ensure triage and the consultation rooms comply with 1 meter distance between patient and clinician. Ensure quarantine and isolation facilities are available, accessible, and well equipped to receive suspected cases. I wish to maybe to actually follow up on this statement that we have observed of the same, and we wish to recommend that the government consider employing more health workers, more specifically the frontliner, who are clinical officers who are seeing this patient in all levels of facility in the outpatient. And it is notable that any issue of flu, of any cough, they are reported to the lower facility. You do not move to the referral facility. We have done a research to our member. We sent out a questionnaire to ask a number of questions which are actually entailed to know whether indeed we are prepared starting from the lower facility. Some of the questions that we have asked our member is to tell us whether they have been supplied with the face mask, 2, whether they have running water in their consultation room, 3, whether they have been trained, and if trained, are they feeling comfortable handling any suspected cases? And if not, what should they recommend that should be done? It should be noted that the government has recommended that we avoid any unnecessary meeting. But if you go to most of our facility, we have crowded patients in the outpatient. So what does that one tell you? That as much as we are telling people that they should not have any meeting, there are meetings that we cannot avoid, like the hospitals. If you move to Mama Lucy today, you'll find over 300 patients crowded together. So we want to encourage the government that they need to employ more health workers. And actually, when we are doing triage, any patient with signs of cough on any flu should be actually be attended aside from other patients. So we avoid them meeting at the same crowded area.
Kwingineko, Wizara ya Afya kaunti